Good morning, everybody. Thank you for joining our May panel discussion with MedCost today. Because May is Mental Health Awareness Month, we are talking about behavioral health. We have our panelists, some of you may recognize, Katie Davis, Renee Pulliam, Zafira Paradis, and Jackie Allen. For sake of time, because this is just a quick 30-minute discussion we're going to have, I have shared their bios in the handout. So if you look to your control panel on the right of your screen, I think it's on the right for everybody. You can go down to where it says handouts 1 of 5, and a little short bio on all of us is in there. You can also post questions there if there's something in particular you're looking for. We'll try to get to it. We have been pretty well packed and usually about 31 minutes in these 30-minute conversations. But if we can get to it, we'll follow up with you later as well. So post whatever comments you like or questions. And I'm going to get started right away. And I believe I warned Katie, the first question is coming her way today. So to start the conversation, why should mental health and mental well-being matter to an employer, Katie?
Yeah, absolutely. Thanks, Curtis. So I think before I get down to more of the business case of this question, I think it's important to set the stage for kind of what where we are with mental health as it relates to the workplace right now, and just in general. So, prior to 2020, we have been doing a really nice job and had momentum in breaking down some of those stigmas, if you will, that are associated with really approaching mental health in the workplace. So we had been doing, making some strides, as I said, breaking down some of those stigmas, getting a little bit more comfortable with promoting resources and tools and just talking in the workplace about mental health. And then, of course, 2020 comes along. And, for those who were already struggling with any type of mental health issue, we really saw a lot of people, the struggle got harder throughout 2020. But I think the bigger thing that we have seen is that those who maybe previously didn't recognize a struggle as being anxiety or possibly being depression, or those who had never felt any type of emotional health challenges before, there was all of a sudden this more of a comfort zone and almost like an okay to be able to raise your hand and say, I'm not okay. And we saw people very more apt and willing to speak up and say, you know what, I'm stressed. I don't feel like myself. Something is not right. So we saw a lot more of that in 2020 with people being more vulnerable and really just more proactive in speaking up. And that also led to, from an employer perspective, really challenging employers to take a look at, okay, we know our employees are not okay. We are hearing them, or we might be feeling this ourselves. What are the tools and resources that we have to make sure that we're supporting our employees as we need to be supporting them? So we've kind of seen a lot of the progression, if you will, leading into 2020. And then I think right now in 21 and moving forward, we're going to see more employees willingly reach out and look and seek out what resources are in place for me to utilize, what tools are there to support what I need or what my family members might be needing. We can't leave the family members out of this discussion as well. So there's a more of a comfort level, a higher level of comfort that we have momentum to continue building on right now as we go forward. So I just think to start our discussion today, that's important to kind of set the lay of the land. But and looking at mental health from why should this matter? Why does this matter from a business case perspective? Reality is treating mental health conditions is expensive. I mean, there's no way about it. It's costly for both the member and it's costly for a health plan as well. And when I say it's costly, the costs obviously go up as the condition goes undiagnosed or untreated. So as with anything, just as we would address any type of chronic condition, diabetes, asthma, hypertension, metabolic syndrome, we need to be addressing behavioral health conditions depression, anxiety, substance abuse, eating disorders, attacking all of this on the front end before it gets to those higher cost claimants on the back end. So very, very similar approach right there. So, looking at, inpatient stays are very costly. Substance abuse can be very costly. So from a business perspective, you look at that from the health plan. You also look at just the fact of what mental health challenges do in terms of productivity. If you've got an employee or multiple employees who are either undiagnosed, untreated, really struggling, you're going to see a higher rate of missed days of work. You're also going to see that, yes, maybe, the employee is there in person, but, they're struggling to concentrate and focus on the work. The lack of resiliency is present. So, you don't have your workforce isn't as creative or focused and flexible, things that you really want to create that positive work environment. We do see many studies that come out with the correlation between, happy and healthy employees, ultimately, if you've got a positive work environment, high employee morale, high engagement, it's associated with higher financial gains for the company. But going back to, no, every day's not Pollyanna and every day's not a happy day, but you do want your workforce to come and feel just as good mentally as you want them to feel physically. So I think that's the big business case, if you will, for why this matters.
Katie, you and I cannot let our public know that every day is not Pollyanna for us. No one's counting on that.
Secret out, Curtis.
I think you make a great point. I don't remember the exact numbers because it's been 18 years since Fisher Vista did a study and found that a well-run EAP, because of the benefit for mental well-being, saw an incredible, I think it's 13 or 20%. I mean, it's an impactful number for lowering workplace safety incidents, and then, so that's talking about one side of it, but the other side is, have you ever called it into a company where you could tell the person you're talking to just didn't want to be there? The ties to the customer are so clear in this. I think that's a really great point. And I think the first point you made is just expect it. People are more and more comfortable, the younger generation particularly more and more comfortable, and even those of us who are less younger, we are more comfortable and past that stigma. And COVID-19 has given us a great reason to be okay with not being okay. I think that's great. What about the rest of the group talking about the importance of mental health and mental well-being for an employer? Great job, Katie. So let's talk about, you mentioned the cost of mental health and the fact that it is definitely a thing. So let's talk about some of the drivers that we see in populations. And I know this group spends a lot of time working across our own clients' populations. So what are the top drivers of mental health needs in most health plan populations today? And I think there's, of course, there's the elephant in the room, right? So I believe, Renee, I'm going to start with you on this one. Let's talk about top drivers.
All right, thank you, Curtis. Just really sort of building on what Katie has already said, when I look at the top drivers of mental health needs in populations today, I actually brought it down to 3 bullets. First, I also am talking about the COVID pandemic, and it has had a significant impact on the overall mental health in the midst of all the stressors that we have experienced in this year. Fear of the virus, fear of death, for ourselves as well as our family members, the social isolation, many of us becoming teachers in our home as well as working in the home, concerns about keeping our job, financial difficulties, food and housing instability, the reports of depression, anxiety, insomnia. and substance use are really at an all-time high. The CDC says 31% of us reported symptoms of anxiety or depression during this time. We're also reporting increased substance use, a way of trying to cope with what we're experiencing. 26 of us are reporting some kind of stress-related symptom, headaches, any kind of physical condition that might come out as a result of stress. 11% are really reporting serious thoughts of suicide, and this has been really visible in our youth, where depression and suicide are at all-time highs. We also know that there is a significant link between chronic conditions, that physical condition, and emotional health. 58% of the American population have at least one chronic condition, and this continues to grow progressively, where people have more than one chronic condition. More and more people have some sort of chronic condition. For years, behavioral health was largely ignored when it came to factors involving physical health. Primary care physicians shied away from considering emotional or mental health as part of that chronic condition. But our data is showing that the two are really closely linked. We see 15 to 30% of people with diabetes have depression, resulting in worse outcomes, increased BMIs, and other conditions like coronary artery disease, cerebral vascular disease, microvascular conditions that impact our eyes, kidneys, and feet. Up to 33% of those who suffer a heart attack experience some sort of depression. 15 to 25% of people with cancer have depression, and 29% of adults with some medical condition have some type of mental health condition. And of the 70% of behavioral health patients, those 70% also have a medical comorbidity. So they are really closely linked. Both physical and emotional conditions are a driver for each other. Studies estimate it can cost as much as 3 times more to treat the physical health of a patient with an underlying behavioral health issue as it does to treat the same physical issue with a patient who doesn't have a mental health condition.
Wow.
So we really need that holistic treatment of the patient. Mental health and physical health being treated together, having that primary care physician, having some mental health support in their treatment of patients. Then the last bullet that I have that is driving our costs really have to do with substance use. Prior to the COVID pandemic, we heard about the opioid epidemic. And a lot of us cope with stressors in some unhealthy ways. We cope with it with food. Some of us use substances. And the National Center for Drug Abuse Statistics reports that we have 165 million Americans 12 years old or older currently abusing drugs. This includes alcohol and tobacco as well as illegal drugs. Of those millions of Americans that are using those drugs, we have 14.8 million or 10.6% that have an alcohol use disorder, and another 25% having some sort of drug disorder. All of these together, I think, is really important give us the state of the union really with emotional health. And Katie spoke a lot about the work that's been done to try to socialize and help destigmatize emotional mental health issues. And I think that has helped. I think that there's a generation of people who feel a lot safer in expressing that they need help. But there are still a lot of people in our workplace who are fearful of asking help, who are fearful if someone in their workplace knows that they have a condition. And this is really a very silent, very, very isolated condition. So we really need to talk about it. We need, the workplace is a perfect place to talk about it, and all those things that Katie said, beyond the healthcare claims, the presenteeism, the resilience, the way people actually have cognitive function in their work, all of that's being seen when these conditions are left untreated. I'll leave this with just saying that we know 1 in every 4 to 5 adults have a mental condition, yet only 1 in 3 really seek treatment. Mm-hmm. So it's really important that we as a culture and as employers try to socialize and make it okay to get that treatment.
If you want to factor out what you just said, Renee, we got 1 in 4. So if we have 100 employees, I've got 20 to 25 who have mental health. And think about the amount of population who has some chronic condition or comorbidities very commonly. And to treat that is 3 times more expensive if they're part of those 20 or 25 employees. I mean, what an important thing. And to your point of a less known or stigmatized thing that people aren't talking about. I think that the ties to the physical is huge, Renee. Thanks so much for that.
Curtis,
Good.
can I expand a little bit on that, because all of that is such great information, but it just made me think about some changes that we're seeing on the provider side of the world in this space, and they're positive. Prior to the pandemic, as Katie mentioned, with the lower prevalence or reported prevalence of behavioral health conditions, we didn't see some of the new emerging models that we're seeing now to treat behavioral health. Access to care in the behavioral health space in particular has always been just a significant issue and challenge. Slightly before the pandemic started, but since it has gone on, we've seen a substantial increase in primary care providers having embedded either psychiatrists or social workers to help address some of those social determinants of health issues that Katie and Renee mentioned. And in working with them, what we're seeing is individuals go to their PCP for their annual checkup. They complete that, and then the PCP funnels them while they're there in the office and they haven't left yet to either go see the social worker or consult with a psychiatrist. So kind of circling on that, that's very exciting. It's breaking down some of those access to care barriers that have historically been in place. And it's taking advantage of a single point in time to bring different types of expertise and specialties to help address these needs for the patients within the population. So I would just recommend to those joining us today, from an employer perspective, if there's really one thing to try to help address this within your own population, it's really try to encourage your folks to go get that annual physical. And hopefully they're seeing a provider that has some of those embedded services within their practice, and they're really addressing those needs.
Great recommendation. Well, for sake of time, so we've got 10 minutes left. I'm going to reprioritize question number 3. It was about the Consolidated Appropriations Act and recognizing or requiring that tie to coverage similar to or in line with the physical benefits, and move on to the future of mental health. We've talked a little bit about where we've come from and where we are today, but what does the future look like for employers' mental health programs? What are we going to see? And I'm going to go to Jackie while you got the mic.
Thanks, Curtis. And it actually kind of extends from what I just shared a little bit. I think there are really 3 main trends that we're going to see going into the future. One of those being mental health treatment. It's going to just become increasingly more personalized. Patients may not even need to leave their homes to access care in these spaces. We know already virtual therapy from the pandemic has really boomed. We expect that to continue. Even though the stigma around mental health treatment and behavioral health treatment has lessened, we do think there is still some of that stigma, particularly for older generations, that's in place. So having those virtual services available, we really hope that that's going to promote individuals seeking and accessing care. Like I mentioned a few moments ago, access to care has historically been a significant issue. It still will remain an issue. We know we have severe shortages of behavioral health professionals to meet the demands. We're also in a state where we're going into a shortage for primary care physicians as well. So I think that model I just referenced, where we're trying to bring those different expertise together to address a patient at one point in time, is going to be particularly helpful. And then when you throw telehealth into that mix as well, hopefully that will really combat that access to care issue. And then I really believe the third trend that we need to think about is, and Katie touched on this a little bit as well, is for employers, providing comprehensive mental health program benefits is really going to be key going into the future to help them attract and retain particularly younger workers. The Generation Zs, the millennials, we're seeing a rapid increase in adoption for mental health treatment. They don't have that stigma as closely tied to them, as I said, as some of us older generation folks. So really making sure that an employer has a strong mental health benefit program to offer is going to be key in retaining the talent that they want to acquire.
That's great. Any other additions to the future of mental health? Awesome. So this is my favorite question, and I usually get more than one responses from this. If an employer could only do one thing to promote mental well-being for their employees and their families, but they were going to do that thing all in really well, what would it be?
All right, I'll take that one, Curtis. And of course, I'm not going to give you one answer. I'm going to give you one thing, but then I'm going to list some other things for consideration.
That wasn't the question, Katie.
I will hold off on this. I would piggyback off of exactly what Jackie just said, and I don't think this is going to come as a surprise to the audience either. I would go all in with telehealth. That way, you are, you're able to hit all generations of the workplace, regardless of if there's a comfort level or not in seeking, in seeking care for mental health challenges. But you're making it accessible, convenient. You're going to meet that employee where they are. Like I said, regardless of their comfort zone. So I would go all in with telehealth. But I would also really consider some other things that typically don't involve a cost. So things such as being open to continuing to possibly allow some flex scheduling. I know a lot of flex scheduling was more, I don't want to say approved, that's the wrong word, but acceptable in 2020. And I think that helped from a stress management perspective for a lot of people. So continuing to whatever degree a company can have that as part of their Is their business makeup, just understanding that not everybody, you can't always be a 9 to 5. So, that's a good relief from a stress perspective. Also encouraging employees to use their time off. That everybody needs a break. Regardless of if your workforce has returned to the office or if your workforce is staying at home, people need a break. Encourage the use of time off. A couple other things to suggest, bringing on the introduction of mental health first aid. It's fantastic training for coworkers, supervisors, managers, leadership level, to really be able to understand and listen in a non-judgmental perspective, being able to more readily pick up on maybe some signs or some triggers that could indicate, suicidal thoughts on the horizon, and really working to kind of create that comfort or that confidence from employee to employee perspective of promoting, and seeking resources and help. But it's training on how to have these discussions in the workplace. And also, introduction of, resource groups. Those are fantastic ways to really allow the connectivity of employees and foster, support within the workplace. But I think ultimately, our leaders of our employers need to realize that they're not expected to be the experts of mental health, not at all. But if they can just bring it to the table and talk about it, that's what needs to be done to promote the resources that are available. Breathe the conversation into the workplace, allow, promote, encourage, all those things, but they don't have to be the expert. And I think that's I think many times we see that leaders think that they have to be the expert, and that creates a discomfort. So then we just don't talk about it.
It is awesome. I love the idea of mental health first aid, all but requiring that. People are, the stigma, the reservation, the self-consciousness that comes along with talking about your own problems, but humans like to help other humans. And if the employer is to, not just encourage, but empower us with that knowledge to help others, well, sometimes, and it's also very human to say, hey, what about me in this situation? And if you're talking about, here are the resources you can make sure that your team knows, or that your coworkers, your colleagues, teammates know, and to empower them with that information. That's the key. I mean, I talk to people all the time, and Jackie, you've heard me say this more than anybody. We've got great programs. Analytics is awesome, but the member, patient, customer, whomever needs to engage, they have a part in it. And simply providing access doesn't require people to access it. You've got to do these other things to really engage people, especially when something is so stigmatized and still so underreported. Renee shared some really great information, and I would say every single one of those numbers was probably light, because mental health and mental well-being is still, conditions with your mind are still underreported and misunderstood a lot of times still. Well, this has been absolutely fantastic. Any last comment? We have about 14 seconds. Any last thoughts or parting comments from the group? Excellent. Well, there are no questions in our repository here. So thanks everybody for joining us. Next, Zafira's been very quiet today. Next month, we are focused on pharmacy, and where our pharmacist, Zafira Paradis, is going to lead the conversation. Everybody will be there. Of course, there's obvious ties into all the medical and mental and well-being things we talked about with pharmacy. But I look forward to seeing everybody the fourth Thursday. When do we do these? The fourth Thursday in June to talk about pharma. Thanks so much. Y'all have an awesome day. We'll talk soon.
Thank you, everyone.
Thank you.